I'm Dr. Dana McQueen, and I'm a fertility doctor at RMA in Northern California. No, there's really not a lot you can do to cause a miscarriage, and so it's really not the person's fault that they're having miscarriages. It's really normally like a genetic or abnormality within the body that's causing the miscarriages, and there's not a lot you can do to control it. Recurrent pregnancy loss is when you have more than one miscarriage, so 2 or more miscarriages would qualify as recurrent pregnancy loss. Recurrent pregnancy loss can be caused by many things. Often it's caused by aneuploidy, which means there's an abnormality within the embryo itself, and that causes the miscarriage. So recurrent pregnancy loss is treated based on what causes we find for it. So initially we'll evaluate the uterus, which could have fibroids, septum, or polyps inside. Then we'll evaluate to see if we think there's abnormalities within the embryos themselves. We'll also look at hormonal causes of recurrent pregnancy loss, like diabetes, elevated prolactin, abnormal thyroid hormone. We'll also look at autoimmune causes for recurrent pregnancy loss, like antiphospholipid antibody syndrome. There's also genetic causes, like a translocation in your genes. So depending on what we find, we'll tailor the treatment to that disorder. If we find that there's often chromosomal abnormalities within the embryo, then you may be recommended to do IVF with genetic testing of the embryo, called PGTA, and that can lower the chance of miscarriage because we can screen embryos in advance and figure out which ones are abnormal. So when we do PGTA, we get eggs out of the ovaries, we fertilize them, we grow them into embryos, and then once we have the embryos, we can test them by doing a small biopsy of what's going to become the placenta. And then once we have that biopsy, we can see which embryos are normal and which are abnormal. We can't fix an embryo, but we can identify which ones are normal and going to likely proceed to a normal pregnancy. I think that recurrent pregnancy loss can be really hard on both the patients, so both the female and male partner. And I recommend getting a therapist to sort of talk through what's going on in your life to get through this moment and know that there's like a very high likelihood that you'll have a baby in the future. And if we keep trying, we'll get there.